So chiropractors adjust misalignments or fixations along the spine. And what is a misalignment or what is a fixation? Basically, it's when the joint in relation to another is not moving as much as it should, and it's not moving as well as it should. So most of the time, a chiropractor comes to adjust or to influence movement in that joint, or they restore the integrity of that joint. So that's what we do when we are adjusting a joint. We are wanting it to move in its full range of motion without pain. So a person can get misalignments most of the time with any movements that they can do that can cause them to move inappropriately. So we are talking of any activity like picking up a heavy object or sitting badly for long hours. Most of the time when somebody has a fixation or a misalignment, the muscles around will also spasm, leading to further pain. So they might have some specific pain, but they must also have some musculoskeletal pain. Another thing is that if the misalignment is occurring in the spine, it can cause some form of irritation to the nerve, which leads to things like radiculopathy and sciatica. Now, sciatica is when the nerve is also being stimulated by irritation that is happening at the joint, either at the facet joint or because of the disc. So those things can cause the nerve to be overly stimulated, which leads pain to go down where it's supplying. If it's from the neck, it will be supplying the arm, and the patient will feel pain coming from the neck into the arm. If it's supplying the lower limb, the patient will be having pain coming from the lower back into one of the lower limbs. That is radiculopathy. So chiropractors work to restore motion in the joints. That motion, when it's restored, the inflammation goes down, and that allows for the nerves to not be overly stimulated, which is why you need to be seen by a chiropractor in order to get properly assessed. And after a full-on assessment, then we go into treatment where we adjust the particular segments that have been fixated or misaligned.